Fertility was a major concern for me because my husband and I had been married 8 years, and we had considered having children but had not committed to it at that point. So I didn't want to have any treatment that would influence that decision later on if I was healthy enough to have children.
Today, most breast cancer survivors will lead fulfilling lives. However, one big question many survivors ask before beginning treatment is, can I still have children?
There are two main issues that we have to look at when we're talking to women who are newly diagnosed with breast cancer who still desire to have children. One is what decade of life they are, 20s, 30s, and 40s. And secondly, whether their breast cancer is estrogen receptor negative or estrogen receptor positive.
Once it's determined a woman would like to have children following her breast cancer treatment, she should work closely with her physicians.
Breast cancer treatment continuum is a real dynamic process. It keeps changing. And so you do want to continue to see your physician and find a physician who will work with you to achieve your goals.
Even though post-treatment pregnancy may not affect survival, there's still many issues for breast cancer survivors to consider when thinking about having a child.
Well, ultimately that's going to be the patient's decision. A lot of factors will play into her decision, and hopefully it will include her significant others, her partner, her family, and whoever she needs on that level, and input from her provider and sometimes a fertility expert or specialist. 3
big issues women are forced to deal with when deciding whether to have children following treatment for breast cancer are passing on genetic risks, facing early menopause, and the long-term consequences of cancer treatment.
Women are very optimistic in general and feel that, with the right treatment, they have a good chance of beating breast cancer.
Another important issue for survivors to consider is the potential for early menopause. Early menopause is a potential side effect of chemotherapy, and essentially ends a woman's chances of having a natural pregnancy. However, if the desire to have children is strong, there are options. With News for the Cure, I'm Dr. Vladimir Lang.